Buenas and half a day, everybody, and Happy New Year. My name is Kiana Yabut from Famalao'an Rights. This is Famalao'an Talks, and today we're starting a brand new season. We've got a whole new setup, and we're excited to start the year off. January is the end of Capricorn season. It's the beginning of Aquarius season, my birth month, and above all of that, it is also Cervical Health Awareness Month. And who better to join me than Dr. Delores Lee from Guam, our fellow nonprofit friends, to talk about cervical health, cervical cancer, prevention methods, and all that. So I'm going to have you go ahead and just do a little introduction for us, Doctor.
Sure. Thank you. First of all, thank you, Kiana, for having us. We're very happy to be here, and I say us because I represent a few organizations. As you stated, I'm Delores Lee. I'm a family medicine physician. I provide services both at Guam Foundation as well as at Evergreen Health Center, and I also am a board member for the American Cancer Society Guam office.
Okay, so kind of jumping right into Cervical Health Awareness. Cervical Health Awareness Month is January, of course. My first question for you personally, and I guess medically, is just like, what is the cervix and what does it do in our bodies?
Okay, that's actually a great question. And that's, it's great that you asked that because it's usually one of the first ways that I start out to explain, right, what a pap smear is, right, which I know we're going to get to. Within your body, right, if we look towards our lower abdomen, I don't know if if we look towards our lower abdomen here, we have what we call the womb, right? That's basically where if you were pregnant, if any, female was pregnant, right, that's where the baby would be.
Sure.
The medical term for it is the uterus, right? Mm-hmm. And the uterus extends into the cervix, right? That's the part that is going to connect the womb to the vagina or the birth canal. Right, so it's
like kind of like the inside.
Yes, it's the inside. So it's in the sense that it's the uterus and the womb is on the inside, and then the part that extends into the birth canal or into the vagina, right, is the cervix.
The cervix.
Yeah, so it's what's connecting the two areas.
I gotcha. And I just kind of recently found this out because I'm a recent period cup user, but cervixes come in a lot of different shapes and sizes. No.
In addition, definitely that is the truth. In addition to coming in different shapes and sizes, I also have to reassure women that your cervix is in different locations. Depending on the time of the month, right? Because I do the exam, right? And one of the things I do when I do the exam is I explain to patients where their cervix is. Okay. And one of the number one questions at that point in time is that normal? And I always reassure patients, I'm like, look, your cervix is going to move. It's going to be in different locations.
I didn't know that.
Yeah. So it's going to be in different locations, kind of just depending, in terms of where we're at in our cycle.
Okay, and what is its role in that area?
Again, it's just so that we have that connection from the inside out, right? So it's
like a hallway,
right? Pretty much, it's more like a doorway. Right? Yeah, like it's you got to look at it as a doorway, right? Because it's a doorway into a hallway that leads to outside, right? So it's kind of like if the womb had a door. That would be the cervix, right? So when you're giving birth, the cervix is what opens up and dilates so that the baby can make it through.
The door gets bigger.
Exactly. The door gets bigger.
That is a great way to explain
it opens up. It gets bigger. And that's how the baby can move from the womb, which is inside, to the vagina, which is outside, right? To the birth canal to come out of the body. Yeah, so it's more like a doorway leading into a hallway that leads outside. Yeah, if you can visualize that.
I think I can. Okay. And I think that is the greatest analogy that I've ever been given to it because, growing up in health class, you have the pictures and the textbooks, and it's very confusing,
No, absolutely. And that's why some part of my prior to going to medical school is I was a teacher and I was a vice principal. So I always believe that we have to help patients to understand what's happening, right? We want you to understand your body, right? And especially when we're talking about cervical health and we're talking about the medical things we have to do to help you to maintain cervical health, these are very sensitive things, right? We're talking about very sensitive parts of the body. So one of the ways that I want to provide patients reassurance is by making sure they understand what we're doing. It's not a complete shock and surprise. And that I always believe that aside from talking about it like what we're doing now, I show pictures as well so they can get an idea, and then I'll try to model on my body to give them the frame of reference for where the picture is.
Oh,
you know, so I'll
okay,
show
okay.
them, like, you know, a lot of times, you know, I'll tell them, like, if we're looking at a cross, you know, if we're looking at the view that you commonly see, it's almost as if like you buzz me down the middle like this and we open myself up, and then
Yeah.
that's what you're seeing in the picture. So
Okay,
that
okay.
helps to give patients a better idea of what we're doing.
So then, and this is kind of like a personal question because
Sure.
again, I'm like a recent period cup user, and I
Sure.
did not know they come in so many sizes.
Yes,
Like
yes, that's
how do you how would one might find out like if you have like a longer cervix, if you have a shorter one? Is there a way of like self-testing and figuring that out?
Well, for most women, right, if you haven't had a baby, your cervix is usually smaller, right?
Okay.
So it's usually smaller, and in terms of like the opening is going to be small too.
Okay.
Right? The more babies that you have, your cervix could get bigger, right? And then
Oh.
as well as like the opening changes from like a circle opening to more like a flat slit opening, because it's been dilated, has
Right.
opened up, and a baby has come out. So that, but I think what you're getting at is, you know, how do you determine what size of
Yeah,
cup, of
yeah.
menstrual cup you're going to use, right? And that's just something that has to be trial and error. Because, like I was saying, some patients, the cervix could be way like towards the front of the vagina, right? So probably a smaller cup,
Okay.
right? And we have some patients that the cervix is way towards the back. So basically, some patients, the door is very close to the outside
Yeah.
of the hallway,
Yeah.
and in some patients, the door is very far from the outside of the
open
hallway.
layout
right?
concept.
And unfortunately, the only way to find out is going to be trial and error. So
Okay.
you would have to make the investment and try the different sizes, and you'll know, right, based on how effective your cup is,
Yeah.
and your comfort level, right, and if it's causing any problems, if you have the right size cup.
Okay, I got you. Yeah, mine was definitely trial and error.
Right.
PSA to anybody using a period cup: you're not gonna get it the first time around, but if you want to try it and stick with it, it has really changed my life and has saved me a lot of money. Actually, I'm gonna be 23 this month, and you know, like there are things that must be done to ensure that the cervix is healthy. So what does that like? What does a healthy cervix entail?
So pretty much what we're just trying to make sure is that, you know, we want to ensure that you don't develop cervical cancer.
Okay, and
Okay.
what does that look like? Like a tumor in the cervix?
Well, you know, definitely. So it really can just start off as abnormal cells, right? And
Okay,
and really
okay.
like, and that's what makes cervical cancer so tough, is just that because it's not exactly inside, it's not exactly outside, right? You may or may not have symptoms, right, to
Okay.
tell you that something's happening, and the changes may not be grossly abnormal. It honestly could just be right there, just at that tissue. So, you know, in order for us to be able to evaluate the cervix, we have to do an exam that allows us to visualize the cervix, right? And that's part of what happens during your pap smear. Like we do a pelvic exam, right?
Okay.
So we do a pelvic exam, which will allow us to, you know, see where your cervix is. You know, we're also going to check motion on the cervix. If, you know,
Okay.
we're checking for tenderness at that point,
Yeah.
right? We'll visualize the cervix as well, see if the tissue looks healthy.
And this is all part of your PAP?
Yes, this is all
Pap
part of
smear.
your pap smear.
Okay.
And so the pap smear itself is when we have a brush that we put in. Okay.
Uh-huh.
And I always tell patients, okay, I know that sounds a little scary, right? But I always tell
It was
patients
scary.
that brush is if you use soft toothbrush, that's how soft it is. And so for a lot of my first time pap smear patients, I will show them the brush that we're going to use, and I'll demonstrate to them, you know, with plastic over the brush. I'll be like, oh, you see how soft this is? So it's not like I'm cutting
Right,
or
right, right,
scraping.
right.
I'm really, it's almost as if you took a toothbrush to your cheek.
It's like swabbing.
Pretty much.
Yeah.
And so, you know, so that's how, you know, in terms of like, that's how we would collect the cells to help us to understand if there's anything abnormal there, right? Like whether it be, it's an abnormal change, it's precancerous, and then cancer. And, you know, since we've started doing pap smears, which we've been doing for over 50 years, we've been able to reduce cervical cancer by 70%. Right? We've been able to
I've heard that it's
save
one of the most
70%
preventable forms
Yes,
of cancer.
and so I'm glad you're saying that, right? Because we know that 99.7% of cervical cancer. Again, I'm going to say it again. 99.7% cases of cervical cancer is caused by an infection, caused
Okay.
by HPV infection.
Yes.
And so, you know, if almost 100% of the cases are caused by an infection,
Uh-huh.
then we can say that if we could do something about the infection, then it could be preventable, right? Like we could possibly eliminate cervical cancer. And the good news is, well, what can we do about it, right? Well, we can vaccinate, right? I think we've all learned about the power of vaccination, right? And so HPV vaccination, which is approved by the CDC for us to use in age, in both girls and boys, men and women, okay, because both men and women can get HPV infection.
This is a gender equality vaccine.
Right, and so we're approved to use it for ages 9 to 26, okay? And that's who the insurance covers. That's also who our vaccine programs cover, and that's who we can give the vaccine to. So if we can vaccinate early enough, right? And that's why I'm saying, like, we want to start at age 9 if we can. Yeah. Because the thing about HPV infection is that it's a sexually transmitted infection. Okay. Okay. We estimate that in the United States, at any point in time within the sexually active population, 80 to 90% of the population will have an HPV infection. And the reason why you don't hear about this, like gonorrhea or chlamydia or syphilis or HIV or herpes, is because for the most part, a healthy individual, a person who has a healthy immune system, is going to be able to clear that infection. Okay. It's only when your body doesn't clear the infection in a timely fashion and that it sticks around and is allowed to result in those cellular changes that lead to cancer. You know, so, and that's why we want to get our kids vaccinated, because you know, in terms of vaccination is more effective if we get you before you're sexually active, before you're infected. Right. But it's not to say, you know, I don't want you to feel like, oh man, I've already been sexually, I'm not saying you, but for anyone who maybe, I don't want anyone to feel like, oh man, I've already been sexually active, maybe does that mean I can't do the vaccine? No, that I said anyone from age 9 to 26 can do the vaccine.
So what about like after that age period?
Okay, so after that age group, technically the Food and Drug Administration in the United States has approved use up to age 45. Unfortunately, the CDC did not adopt this because they didn't feel that the evidence supported, you know, benefit in vaccinating age 27 to 45. So what does that mean, right? If we have FDA disagreeing with the CDC, well, technically, if FDA says we can use it, it means that if you're age 27 or older and you want to get it, you definitely can come in and you can have a discussion with me or any of your doctors about, you know, well, would this be beneficial? What would it entail? You know, and then the thing that we will tell you is that because CDC only approves to 26, insurance is only going to follow the CDC. I had patients who are 27 to 45 want to get HPV vaccination? Yes, I have. And after having an informed discussion with them and coming to a decision that they're comfortable with, their decision, they have decided to go ahead and proceed with the vaccination, understanding that they would have to pay for it out of pocket. Yeah. So it's an insurance thing at that point. Yeah.
That's so interesting. Okay, so we're talking about pap smears here. We're talking about HPV, it evolving kind of into cervical cancer. Can you kind of? I've gotten my pap smear. I got mine last year.
Thank you.
And yeah, you're quite welcome. I think my pap smear was, well, it's a scary procedure. I think going in, especially your first time. And I think my experience is different from maybe a lot of other people's because I had gotten mine and the doctor had asked me like, oh, is it okay if we have, you know, 1 or 2 med students come in and watch? And of course I said, yeah, sure. I'm all for educating the youth.
Thank you.
However, like 8 to 10 medical students came in. The room was so crowded. And I was just like on the table. You know, it's very like, you're very exposed.
Yes,
you know?
No, absolutely. I do hear you. And I'm so sorry.
No, you know, I mean, luckily I got through it and it was actually, you know, it feels weird, but it's tolerable. And, you know, it's something that I found that's necessary, clearly medically, and luckily my results came back and everything was okay.
And I'm glad to hear that.
But I kind of wanted to ask you, like me, I didn't get like your normal PAP experience. So like normally when you go to a clinic, like what's it like?
Okay. So every provider is going to be different, right?
Yeah,
and I want you to know, like, I teach medical students too, right? I teach medical students as well. I want you to know that too, right? I'm still faculty for my medical school.
Sure.
I still have medical students who come, and they come here. But this is what I'm going to say, right? I'll, since you're sharing, I'll share.
Okay.
Right? And then I'll talk about
it's like girl time.
how this has formed like my experience, right?
Okay.
So back in the day, right? Because Dr. Lee's quite older, right? Now, so I just want to say this first. Now we do pap smears at age 21 to 65. Okay, like that's who we do pap smears for. It's age 21 to 65. It doesn't matter if you're pregnant at 19. I'm still not going to do a pap smear. We do not start until age 21. Okay, and then we finish at 65, provided that you've been adequately screened. Adequately screened means that we either have 2 cytology results that are negative, or we have 3 HPV results that are negative within 10 years of your 65th birthday. Okay, so let me just put that out there first, because now we're going to go back into the dark ages when we did PAPs way before you turned age 21.
Oh my, like how early?
Yeah, honestly, back then, the thought was, at least for me, for my age group, back then the thought was we needed to start PAPs the minute you became sexually active. Okay. And as you know, we have many young men and women who become sexually active in middle school.
Yeah, in Guam, I think most teenagers have their first sexual experience at the age of 15.
Right.
That's quite young.
Right. No, I mean, I have to say, as a physician, my youngest mom was 9 years old. Right. And the dad was 10. Wow. Having children. Wow. Right. So that's what I'm saying, like, so it was very, very different back then. Yeah. And if you were pregnant, that automatically you were going to get a pap smear. Yeah. Okay. Very different, very, very different. Again, age 21 to 65 now, regardless of whether you're pregnant or sexually active. Okay. So I'll share my experience, and she very graciously has shared yours. It was my first summer home from college. My mom was like, "Oh, I made an appointment for you to see the doctor," right? And I had just turned 18, so no more pediatrician, right? And my mom made an appointment for me. I'm not going to name names, right? Made an appointment with me with, a gynecologist for a woman's exam, and here I am used to going to a child check, right? With your pediatrician where the clothes don't come off, and so didn't warn me that would be the experience, right? Yeah. So imagine my shock and horror when, I'm this very shy. I'm not body confident, right? Like I'm not. That's not who I am. Okay, very shy 18-year-old.
And like moving from like peds to like family medicine is already so scary.
Right. It's a different experience.
I just recently made that switch and it's terrifying. I can only imagine.
Experience, right? So and I'm glad you mentioned that, because I'm family med. So I'll say what I do through transition. So I always recall what it felt like for me. And to be like there and have her ask like all of the standard questions and then feel like, okay, we should be done. And then for her to just say, okay, I'm going to leave the room now. You need to take all of your clothes off and lie down on the exam table. I was like, what is happening? No one told me what was happening. and me being, the people pleaser, rule follower that I am, I didn't like say anything. I was like, oh, okay, I guess I take
you were
my
just
clothes.
Like, no questions.
I was like, I guess I take my clothes off. How do I put this paper thing on? How am I covering? Who's coming into the room? Wait, and so imagine the conversation I had with my mom when I got home. I was like, Mom, you didn't tell me that was what was going to happen.
I would have been so furious.
And she was like, well, I figured you were away at school for a year. You would have like learned these things. And I was like, no, Mom, no,
You set me up.
Right, like, so no, right? So let me just say this, right? As a family medicine physician, I have the pleasure of taking care of babies and young children, but I definitely do have a lot of pediatric patients who will graduate into my practice. Right. And so one of the first things I do at the visit is I will like talk with them about, what does it mean to be an adult patient, and what are is the visit going to change? Yeah. What are the things we're going to be asking? What are the things that we're going to be doing? And so one of the things I really make sure all of my young women understand, right, especially because they make that transition right before their 18th birthday or at their 18th birthday, or when they start to have period problems, okay, I really make sure that all of my young women are prepared ahead of time before that 21st birthday and the exam after the 21st birthday. I always tell them, I'm like, you know what's coming, right? Your pap smears are going to come when you turn 21. We don't have to do it on your birthday. I will go through explaining to them what the exam is, what it's about, why we're doing it. I'll show them pictures. I'll, encourage them to talk to their friends who maybe had the experience, and I'll tell them that we will schedule it for the next visit because I want them to be prepared. I want them to know that that's what's going to happen.
Great. Yeah, that is so great.
And so even when they do come in, even though we've had maybe multiple conversations, I feel like I can, my patients can share with me how they're feeling. I always check in with patients. How are you doing? Are you okay? You ready to do what we're going to do today? No pressure. We can always do another day if you're not ready. But if you're ready, let's do. Okay. And I honestly will, again, explain to them what they're going to do. I will ask them their preferences. Do you want me to talk you through the exam, or would you prefer we talk about something else while we're doing the exam?
Yeah.
And I will go to the extent, believe it or not, I will go to the extent of what will it take to make you feel comfortable.
Yeah.
So I,
play music.
Yeah. And so I was actually going to tell you that at times, sometimes you will hear hip hop music coming out of my exam room, or like love songs, right?
Yeah.
Because people,
that would have made me comfortable.
People just want to feel like comfortable. So, I definitely have my Spotify ready to go on my phone, right? So that I can be able to do that for patients. So we want women to feel comfortable. We recognize, I tell patients this all the time, it's unnatural, it's invasive, it's uncomfortable.
Yeah.
I get it. I'm a woman. But at the same time, too, please know that as your physician, I wouldn't recommend us doing this if I didn't think there was benefit to it. And it's kind of like what I said before. As soon as we started doing this and we started screening, over the past 50 years, we've been able to reduce cervical cancer rates by 70%. That's huge. Right? And now if we continue to do this and combine that with HPV vaccination, I'm, like I said, I'm part of American Cancer Society. We believe that we can eliminate cervical cancer, or practically eliminate it, right? Down to less than 1%.
Yeah, that's insane.
If we can get everyone to do the screening, to do the vaccination.
That is absolutely insane.
Right. So that's great. That's amazing to say that a cancer could be preventable, right? But the other,
almost 100% preventable.
Yeah, for cervical cancer. And but just know that the vaccine protects against other cancers as well. It actually protects against 6 types of cancer. So oropharyngeal. Okay. Vaginal cancer, vulvar cancer, anal cancer, penile cancer, right? So with cervical, those are 6 types of cancer that the vaccine can protect against.
It's like buy one, get 5 free.
Yes, definitely. And the data is very, we have 20 plus years of data for the vaccine, so we're very confident in its safety and its efficacy. We've seen HPV infection rates drop about 70% since we started within the populations that we've vaccinated. So it's really effective.
I mean, I can definitely see that. Other than the HPV vaccine though, and is there anything else? Are there any other preventative measures that are really big for you?
Okay. And so these are the things they're going to say. Thank you for giving me that opportunity, right? That, remember, again, I'm just going to reiterate, because repetition's the mother of all learning.
Period.
So I'm just going to reiterate. Remember, 99.7% of cervical cancer cases are related to an HPV infection, right? Okay. So when we're talking about other preventative measures for cervical cancer, aside from getting vaccinated for HPV, aside from getting your regular screening, right, in terms of your pap smear, as well as, HPV screening, because we can do that as well. Other things you can do is you can reduce your risk factors that increase your risk of HPV infection. Okay. Right? So remember, I said it's a sexually transmitted infection.
Yeah, let me guess. Protected sex.
Well, absolutely, right? But also, let's be discriminate about who we choose as partners, right?
Also
because
very important,
the more partners you have, right, if we're talking about 80 to 90% of the sexually active population is infected, the more partners you have, the more chance for you to get infected, right? So we do know that earlier onset of sexual activity is one of the risk factors, but I think that's tied to the fact that if you have sex earlier, you may have more partners. Right. And if you have more partners, those are more opportunities for infection. right? So those are modifiable risk factors. That's what we call those. And in addition to that, smoking is actually a risk factor for HPV infection. Yes.
How interesting.
Because remember what I said, if HPV sticks around, right?
Yeah.
Like if your immune system's not healthy and it allows the infection to stick around and make these changes on a cellular level that lead to precancer and then cancer, then that's how the infection leads to cancer. And so smoking, right, can cause chronic inflammation, right, which is going to contribute to that, right, make you more susceptible to infection and more susceptible to the infection staying. So smoking is another modifiable risk factor for HPV infection and hence cervical cancer.
Okay. Yeah. So we've got HPV vaccines, try not to smoke, try to limit your sex partners, get your PAP, get checked. So then I'm going to transition over a little bit now into the work that you do as Todu Guam. We know you guys have the mobile clinic, and I have recently just been made aware that you guys do free PAPs.
We do. So we, starting last year, we received a grant from the Guam Cancer Trust Fund.
Okay.
And, really, one of the things I want to say, right, is that cervical cancer, here I am telling you about all these breakthroughs, right, and everything that we can do, right? But let's talk about, how is it impacting our island and how is it impacting our population? It's still a top 5 cancer for new cases in females on Guam.
Oh.
And it's still a top 5 cancer for cancer deaths in females on Guam. Right? So top 5, right? And here I am talking to you about how preventable it is, right? So definitely, is there a need for us to continue to address it? Absolutely, 100%. But what is something that we often hear, right? And again, I'll even speak from my own experience, right? I remember moving home and trying to schedule an appointment with a gynecologist, right? Or even just a regular doctor to be able to get my annual with my PAP. And it was a 3-month wait time.
Wow.
Right? And so one of the things that Todu Guam is really trying to address is access, right? Because we understand that it's very hard, whether you're insured, not insured, to be able to make an appointment for yourself, and that it is quite the wait time, right? And with that, sometimes, remember you told me, right, this can be a very uncomfortable, it can be very invasive, right?
I would change my mind.
Right, exactly, right? And so one of the things that we've been able to do is that we were able to successfully apply for a grant with the Guam Cancer Trust Fund. And we received those funds that allows us to be able to conduct a well woman clinic in the sense that we can provide cervical cancer screening as well as HPV vaccination, irregardless of your insurance status. You just have to be eligible, in terms of, like I was talking about, the guidelines that we use for age, for both the vaccine and for the screening. And that we have worked hard to ensure that our patients have access, right? So something that I've been practicing on Guam for almost 8 years now, and something that I hear from patients time and time again is, doc, do you have hours after hours? Because I have to work or my class schedule. So that's something we're able to do with Todu Guam, that we have extended hours into the evening, and we do that 6 days a week. So we even have Saturday hours, and the Saturday hours go till 6 o'clock, right? So that's something that we do. We try to make accessibility to us even greater by, where we have a social media presence. You can DM us, you can make your appointments online.
Oh yeah, I'm definitely getting my next PAP with you.
We definitely can do things that way, right? And then our mobile clinic allows us to go out to the community, because the other huge barrier, aside from not having insurance, right? Or not having the money to pay, right? You may have insurance, but you may not have the money for the copay, right? For the additional services, and that's many, right?
Yeah, that's like almost everybody.
Right. That's so much, right? Because especially with just how hard the economy is, right? The other thing that I often hear from patients is transportation.
Oh, you guys also do transportation?
Well, in terms of, we bring the clinic out.
Oh,
right?
the mobile clinic.
We'll bring the clinic out to the community, right? We'll bring it out. We're at Gilbaza, right? We were also at the University of Guam, during the IRT, right? We've talked with businesses that are concerned about their employees not having the time or the access to healthcare, and talking with them about maybe creating an event for their employees, right, to be able to take care of their health and for us to come to the site. So that's a wonderful thing, right? And that's how we continue to work for access so that everyone can receive medical service on Guam. So we're constantly trying to think about how do we address the challenges and how do we overcome those challenges? How can we meet patients in a place that allows them to receive service?
Yeah, and that's something that we as Famalao'an Rights also advocates for. We're always talking about, sexual health awareness, women's reproductive health care, access to all of safe and easy access to all of these things. And so, with you guys at Todu Guam, we really appreciate what you're doing. And hopefully maybe we can do something like together soon.
Absolutely. And I love that you said those things, right? Because here I am telling you like our grant covers, cervical cancer screening and HPV vaccination. But I want you to know that we still want to provide as much as we can, right? So we're very thankful for our partners, Department of Public Health and Social Services, their family planning, STD, HIV program, as well as their vaccination immunization program, so that it can allow us to, extend those services to women, and as well as the breast and cervical cancer early detection program. So we really work hard to find partners so that we can find solutions so that our patients can receive those services. So we'd love to come along with another partner as another way to get more young women, more women to come in. Right. And again, remember, cervical cancer screening is for anyone who has a cervix. So, right, we want to be inclusive. And not just inclusive, right? We want to stand in solidarity, right, with our LGBTQIA, right? So for our trans, trans men, right, who still have a cervix, please understand that you still need to come in for your cervical cancer screening. And that, again, right, we're a friendly place. We're inclusive.
Safe space.
Right? It's a safe space. And we stand in solidarity with you. That we really want to be able to provide care for everyone.
Yeah, and I'm sure that means so much to the trans community here, to the queer community. It's really hard. I mean, even myself, like as a young cis woman, it's scary for me to schedule something like that. And so we really appreciate you kind of just openly saying, because I mean, I'm sure some other clinics will take you, but they're kind of like hush hush about it.
Right. No, and we, and I have to say, right, like prior to going to medical school, I was part of Guam Project, so Tim Dela Cruz, Al Severio, Terry Uggan, they remain lifelong friends of mine. And I'm just so thankful. When I was in grad school, I was the only heterosexual person in the house, right? And everyone, and actually all of my roommates were HIV positive, right? So all of these experiences have helped me to have that broader perspective. And I'm not saying I know it all, right? But I'm just saying that I hope that they understand that if you come see us, we as providers, want you to feel welcome. We want you to feel it's a safe space, and that, I always say this: when I care for patients, I care for you the way I would care for my family. Right?
And that is so important.
We want to just, so we just want to make sure that, everybody understands you're welcome.
Yeah, and I think that kind of openness to having all people come into your, your clinic is so important, especially in an island like Guam. We're still kind of behind in kind of accepting people as who they are, the LGBTQIA, however you identify. And, I'd like to thank you again for joining us today. This has been so fruitful for me, learning everything about cervix sizes to pap smears to your experience, and like just generally feeling like I wasn't alone in that.
No, not at all. Not at all.
Yeah, so I really, really appreciate it. So my outgoing question for all our guests before we close the episode is, who is your favorite woman?
My favorite woman? Wow, I'm going to get emotional.
And that's okay. That's okay.
My favorite woman's my mom. And I'm going to get emotional because, my mom's since passed. But, it's just, I think that's the reason why I have so much empathy as a physician, because my mom had 5 different types of cancer in her lifetime. Yeah. And we went on so many different cancer journeys together. And, you know, and so she just had so much strength, so much faith. And despite having all of those challenges, still just had so much love for all of us. And, you know, one of the things my mom used to say to me when I was in medical school, and mind you, you know, when I was in med school, you know, my mom got diagnosed with her last, you know, basically her last cancer diagnosis the week I graduated from med school. But when I was in med school, my mom used to always tell me, I'm praying for you, and I'm praying for your classmates and for your teachers and for everyone that's involved with you, because I know that you're all good people who are going to take care of patients. And, you know, that's always stayed with me. And I always shared that with my classmates. We have this wonderful picture at home with my mom on stage with me when I'm graduating from med school. And you can see actually all of my classmates looking, because they knew that she had just received her cancer diagnosis. But they knew that my mom had always like supported us and like kept us in her prayers, because she really believed that we were all good people who were going to take care of patients. So, you know, the woman that I admire the most, the woman I love the most is my mom, because, you know, her life is a testament to strength, to faith, and to love. And she was just this really wonderful, loving person who was just always so kind.
Absolutely.
And so, you know, I'm sorry for getting emotional, but my mom has since passed, but, you know, she remains very close in my heart and the hearts of our family.
And I'm sure she's very proud of you. Just
Thank you.
Kind of, you know, we've only just met today, but, you know, I really already very much admire you and the way that you practice. You know, I'm sure your mom is very, very proud.
Thank you.
And so thank you again for joining me on our first episode of season 3.
Thank you.
Again, my name is Kiana Joy from Famalao'an Rights. This is Dr. Delores Lee with Guam, and we will see you next time. Bye, everyone.
Bye. Thank you.